Okay, we are back.
All right.
We're starting this video over again because we had some technical difficulties. Welcome to Dr. G and the Boss. Today we are going to be talking about heart disease. Please let us know if you can see us. Can you see us now?
Yeah, so before we were having a problem, nobody could see us.
Can you see? Okay, good.
Much better.
I think it's me, honestly, I think it's me. Every time I want to make a change to something, it messes it up.
Yes.
So I think I'm cursed.
They can see us instead of hearing us. You know, they say I have a face for radio, so it might have been better. All right, so today we're talking about heart disease and what we can do about it. So, you know, it's what, 1 out of every 2 people has a risk of heart disease, so this is like something everybody's dealing with. And I know you just did a talk about it. And
I did.
Oh, we got to reintroduce ourselves then.
Yeah, so...
This is Holly Hajjaj.
Sorry, we're repeating for the people that were in the last video, but my name is Holly Hajjaj. And I'm the corporate wellness director at the YMCA, so help companies create cultures of wellness and help individuals at those companies work on their own wellness initiatives. And then I also teach yoga and Pilates and like all this health stuff, and probably I'm a little bit of a nerd because I'm hanging out with this guy.
That's right.
And so we're here to talk about this heart disease. Dr. G is doing something weird with the phone. If we lose you, please tell us. Woohoo, someone turn their lights on.
All right.
We have new lighting today.
Yeah. We're all high tech.
Yes. So, Dr. G, why don't you introduce yourself and tell them what you do?
Well, my name's Holly Hajjaj.
No. Yeah, the more of us, the merrier.
So, I'm Dr. Garrett. Yeah, I have a functional lifestyle medicine practice in Newton, Kansas. Wichita, Kansas, but I have patients all around the world, which is kind of cool. And basically try to help people figure out how to reverse acute and chronic problems that no one else can figure out. And most of it's done through lifestyle. So.
Okay. Guys, I want to let you know my phone's not working, and usually I look at your questions on my phone. So I'm writing down notes here for these questions as they pass through the feed.
Yeah, we have that too far for arm's length now.
By the way, see what I mean about technology? There's something about me. So, okay, so we'll try to get back to those when we can. I'll keep taking notes.
Yeah. So you just did a talk about this, didn't you?
Yeah, we just did a webinar on preventive practices, and we focused primarily on heart disease just because so many of the symptoms and the risk factors that we have lead to that. And like Dr. G says, 1 out of 2 people are at risk for heart attack or stroke. So half of us in America are at risk. What? Will you let me know if he is doing
50% of us?
Oh, and he's pointing at me, right?
Because women are more likely to have heart attacks than men. So you're number 1.
Whatever.
You're number 1.
So let's define just a little bit what is heart disease, just to clarify. So this includes any condition related to the heart or blood vessels, including heart attacks, strokes, angina, no jokes inserted there, arrhythmias, coronary artery disease, congenital heart disease. I was born with a congenital heart defect, so I had open heart surgery when I was 5.
Show me your scar. Brag about it.
That's not what we're here for today.
Oh.
So congestive heart failure and more. So you might fit, most of us are probably going to fit into this category based on the definition of heart disease.
Did you get a monkey heart?
I did. Everyone, did I get a monkey heart? What do you think?
They give people pig hearts. Pig valves.
No one has lived with a pig heart.
Did they take your heart out?
They did. They
replaced it with like a crank.
I have to crank it up every night. So
if you fell asleep too early, you died. Got to crank my heart.
So for some people, this is a real issue. We've got pacemakers. We've got things that are keeping that heart pumping.
Well, that's
So I bet you offended all of them.
I did. I do a good job at that. You know, they have a new artificial heart that has a screw. You know, like it has a screw valve, and so it doesn't have any pumping, and so those people have no heartbeat. Thus, they're vampires, and you gotta kill them.
I have heard about that.
Vampires?
No, the no heartbeat.
No heartbeat. All right.
Real quick, one more statistic.
Ooh.
2,150 related deaths daily. This is one person every 40 seconds, or theoretically, during this talk, 80 people will die.
That's crazy.
So, something to think about, something to be aware of, and something, the cool part about our discussion today is this is something that you can heal and prevent.
Yeah, that's true. So no matter what stage of heart disease you're in, theoretically you have the ability to reverse it, because heart disease is really just kind of inflammation, imbalances of biochemistry, and you can, like fibrin, which we can reverse. So, you know, there's no lost hope for most people. It's just a matter of will you actually do those things. That's the biggest part of it.
And the other thing in terms of this prevention and healing is that often heart disease is not diagnosed until after symptoms start occurring, but by that time we've already done damage.
Yeah.
So we want to make sure we're staying ahead of the game and doing and practicing healthy lifestyle practices before when we feel good.
Yeah.
When we feel good.
Right, that's exactly it. I had a patient one time when I was doing rounds at in Heston for internal medicine, and the patient came in with a little jaw pain. You know, no big deal. You know, and he ended up dying 3 times that day and being brought back while on the bus to the ICU.
Oh my gosh!
That's pretty crazy.
What was the jaw?
Well, because the heart, the valve, you know, the aorta comes over, and then one goes up the left side, one goes up the right side, and so then one goes down to the rest of the body, to the left arm. Oh, I guess it's this way, and then to the left arm. So that's why the left arm usually goes numb, because it's the last main artery of those 3 to go off. So if there's a narrowing or there's a decrease, then that's the arm that's going to get the least amount of blood versus right arm. But then left jaw and then right jaw, of course, brain.
Yeah.
So jaw pain's a big one for that.
So, thank you for your comments and questions. Tim says this could easily be a 2-hour show.
It is a 2-hour show.
So we might have to extend it depending on our energy level and yours tonight.
We could call it extends version.
The extends. Depend on the extends.
Do you know what that is?
No, extends?
Yeah.
I was thinking of depends. I don't want to know what extends is.
It's a late night infomercial. It's great.
Okay.
All right.
So we could split this up too and do the next half
On
next
extends.
week.
And I like that you have blood vessels. You know, the heart includes the brain, because all the blood vessels in the heart. So heart attack, stroke, it's the same thing. A stroke is just a heart attack in the brain.
Metoprolol. Okay.
Yeah.
Taking notes.
That's a beta blocker. Big beta.
Okay. Guys, I want to say once again, for those of you who are making comments, my phone's not working, so I can't keep track of them like I normally do. If it's longer and we can't read it, we can't get to it, we will try. You need to work on your patience.
I do,
So-
all day long with patients.
Wow.
All right.
Okay, so real quick before we get into the meat of the matter, Dr. G, can you answer a few questions that have already come?
Sure.
Okay. Can you heal arrhythmias?
Oh, absolutely. Arrhythmias are like one of the fastest things to fix. Like, it's amazing. So just like any other condition that we have, it's self-induced. So it's something that we're eating, drinking, breathing, doing to ourselves. One of the first things for arrhythmias is caffeine. So where we look at something as simple as, you know, it takes 350 milligrams, cause anxiety just overall. But what about like disruptions of the cardiovascular function there? You know, one venti mocha at Starbucks may be enough to cause that arrhythmia. If that's your daily thing, that should be daily arrhythmia. For other people, it's alcohol. And it's funny because it really is. I think like almost every single patient so far, it's been like that easy. And I had a patient that came in, and it's a guy, because guys are the worst patients, and he said, "Oh, I don't know. I've been to all these electrophysiologists. I've been to every specialist, and they said there's no way to get rid of it. You have to, burn out the SA node, and you have to get a pacemaker. There's nothing else you can do but ablation, and you might take 2 or 3 or 4 ablations to get it done." And I was just like, "No, I don't agree with that." And because it's just, there's a way that cardiovascular function works, the electroconnectivity, and so I gave him my ideas of what he should do, and then he disappeared. And he was a son of a friend, and I thought he just kind of went and got his ablation, but come to find out, like 3 months later, his mom had said, "Well, he doesn't have arrhythmias anymore. It just turned out to be all the alcohol. Like, he did lots of mixed drinks and all that kind of stuff." And for some people, that not red wine alcohol, but the other alcohol, especially sugar alcohol, ended up causing him to have the arrhythmias.
Yeah.
So it's just lifestyle.
So caffeine, alcohol. What about digestive issues? Can that cause irregular heartbeats and?
Yeah, and even there's I think it's T4, the thoracic nerve. So with arrhythmia, it could be your heart runs off omega-3s. So that's a lot of fish, wild-caught fish, free-range meat, a lot of fruits, vegetables, nuts, seeds, berries, legumes, greens have a lot of omega-3s, which actually protect and reverse heart damage. But omega-6 food, like corn-fed cows, corn-fed chicken, corn-fed fish, one of the 4 things that it causes is arrhythmias of the heart. So just eating grass-fed meat versus corn-fed may make a difference in that. And then, that's also digestive stuff that's like stressors. That can cause a little bit of arrhythmia because you're getting this sympathetic nerve stimulation, and so it's kind of like sputters. There's a part of your back called T4, your 4th thoracic. It actually has a sympathetic nerve from the sympathetic chain ganglion that goes to the heart and says, override the parasympathetics for normal beats, and then you end up getting these really fast beats, and it might sputter a little bit if you're just having a little bit of irritation. So sometimes people get their back adjusted and the arrhythmia will go away. Sometimes it might be digestion, sometimes it might be anxiety, sometimes it's a little bit of a mix of everything. Yeah. But mainly it's something that you are doing that can be reversed.
Yeah, and that's what's I think is exciting about preventive and lifestyle medicine, is that I think our first go-to, or the way we're kind of conditioned in society, is we go to the doctor, we get medicine. Yeah. If medicine doesn't work, we get surgery.
And the med that they use is just like the metoprolol. They're beta blockers. And the whole goal is to just slow down your heart really slow. And then it's less likely to have extra beats. And then you're like, oh, I can't function anymore. I can't stay awake. When I bend over and stand up too fast, I faint and break my hip, end up in a nursing home. So the medication that they use often is really messed up. And then the other one, which I can't remember, I can't remember what that is. But there's a very common one that's just specifically for arrhythmias, but it can cause some problems too.
Hello, James. Do you only have a hello for Patrick, or just kind
James is just saying hello to me.
Oh, I see. So. We're playing favorites this evening. I see.
That's my boy.
Thank you for your question on arrhythmias. Yes, Alfredo, we will talk about the benefits of a plant-based diet.
He wants to know the benefits of Alfredo sauce.
No, the benefits of the Italian preventive diet.
Yes, that's true.
Deb had made a comment about her dad running on batteries at night for heart issues.
Really? That's old school.
Yeah.
Nice.
And then we also had a question about dark lines and their dark lines under the nails and their association with heart valve issues.
Like Bose lines, I think.
Okay.
Yeah.
So
fix the heart thing so you can get the fingernail thing figured out.
Yeah. We're gonna start where you need to fix it anyway, and not focus as much on the nails.
Right.
Is that
Right. Yeah. Just paint your nails and the lines disappear. Your heart condition's gone.
Yeah.
It's gone.
It is truly as simple as that.
If your arrhythmia gets bad, just turn up the radio and then you don't feel it anymore. That's how you solve these problems.
Yeah. So, back to heart disease and the whole meat of the matter, and we talked about the statistics and the definition, and now we're going to talk a little bit about the risks and the causes. So
that's a great idea.
Yeah. So what causes heart disease.
Tell you what doesn't cause it. Cholesterol.
Cholesterol. He says,
Yeah.
no, that is a controversial comment.
Who says that?
I don't pimp my... No, I just said that.
Oh, all right. Can't be making up statements for people.
So, do you guys, I'm going to ask you guys,
Ooh.
what do you think are some of the risk factors for heart disease? Can you please type those in?
Yeah.
What are some of the risk factors for heart disease? And go.
Go. So, one thing, why they're doing that, I'll go ahead and tell you it's not cholesterol. So the idea that cholesterol causes heart disease means, and maybe it's true,
Hello, Tammy.
but that God,
Stress.
no, that's not it. No, seriously, this is really the cause. God made cholesterol, and then he made bad cholesterol, but he only made it bad for Americans because God hates America. Right?
This is a
Because
really...
we have too much freedom, and he hates all our freedom, and so he wants to kill us with this bad cholesterol. And that's why animals can have cholesterol and not have heart attacks, because they don't have a lot of freedom. And then other countries, they don't have as much freedom as we have, so then they have 70% less heart attacks, but yet have cholesterol.
This
higher
is the
cholesterol.
This is the BS part of the show.
You're not buying into this?
Too much sitting. Okay, let's go ahead and validate some of their answers.
I gotta finish my cholesterol thing.
Okay.
The countries with the highest cholesterol have the fewest heart attacks. The countries that artificially lower their cholesterol, like us, we have the highest heart attacks. And you are just as likely to have a heart attack with cholesterol over 300 as over 200. And 70% of those that end up in the emergency room now for heart attacks or stroke have below 200 cholesterol artificially. You are now more likely to have a heart attack in America by artificially lowering your cholesterol.
Okay.
Thank you very much.
And we'll talk about that too. We'll talk about what, why they think high LDL cholesterol is concerning, and like how does it build up and plaque in the arteries and why. But I want to thank you for your answers too. So would you like to hear their answers?
I would love to hear their answers.
So we had stress, inflammation, smoking, too much sitting. And then Linda said everything we love is bad for us.
Aw, that's sad.
So
fruits and vegetables love you.
Okay,
Lots of seeds.
I'm the first one to agree with you on that, Linda.
No.
Right, but I think what we're trying to do is create a little bit of a mind shift that we can really love healthy. We can love healthy too.
That's right.
So,
well, I like healthy because I like feeling good and energetic. That's why I like it.
So, yeah.
I used to like the bad stuff, but I didn't feel very good with the bad stuff.
So some other things. Age
No.
is not a risk factor?
No, it's not. They say it is. But now, so used to, you had to be like old to get heart disease. Oh, you get old, everything falls apart, right? But then it was like 50-year-olds having quintuple bypasses. And then we were like, what the hell's going on? And then it's 40-year-olds getting bypasses. And then now we have 30-year-olds and 20-year-olds having heart attacks. We have teens having heart attacks now. Teenagers.
Okay.
Right? 22,000 young Americans go to the ER every year for cardiovascular disease from just Red Bull.
Okay.
Right?
Yeah.
So, my sister, hopefully she's not watching this, but she had a heart attack at 36. And but there was no surprise that she has a heart attack. She was very stressful, kind of ate crap, and that's what happens. But we see heart disease now starting in kids as young as 10 years old.
So
10. So that old age thing, like, well, if you get old enough, everybody dies of something. Yeah, now we have teenagers dying of stuff.
Okay.
That's some bullcrap.
You're all right. Here. What about? Can you speak very quickly without getting into a whole new show on genetics?
Only 1% of things are genetics.
Only 1% of the things that are unchangeable
Yes. So
in your body is based on genetics.
Right. So 99% of all your problems are what you eat, drink, breathe, rub on your skin, and stress. It's what we do to ourselves that cause these chronic problems. And so...
And we know this because we know there are cultures around the world who don't have the same problems that we do.
Right, like almost every other culture. That's because
I think you're anti-American.
God made cholesterol to kill Americans.
Okay, what about some other diet? Yes, thank you, Alfredo.
Oh, Alfredo knows.
What about
He be knowing stuff.
blood pressure?
Yes, but blood pressure is related to all the same stuff. So hypertension for sure. And again, with that, corn-fed junk food or corn-fed people or corn-fed animals, we said 4 things. So one of them is arrhythmia. The other one is hypertension. Then we have pain, inflammation. Then we have clots, which is heart attack and stroke. So yeah, high blood pressure definitely is one. And they actually keep lowering the numbers to get people on meds earlier now. So
does anybody know how to lower their blood pressure? Does anybody know what lifestyle choices you can make that might lower it? Oh, good. I think my phone's working.
Phone's working. So there's divorce. There's never having children. There's never... No.
Here we go. Sorry. I need to be able to see these questions, so I had to keep checking my phone. Okay.
So, yeah, and we'll talk about all that stuff, too. Hey, who has more heart attacks, men or women?
Stay single.
Stay single.
Yeah.
Single people actually die earlier, though, than married people. But I wonder what a happy marriage versus, marriage versus horrible marriage.
Right.
So some people are single, and then they die earlier, but maybe they want to die earlier. Why do men die earlier than women? Because we want to.
So I'm going to jump in here a little bit just for a couple of things on blood pressure.
All right.
Things you can do to lower blood pressure. So let me finish with this before you jump in.
All right.
Reduce sodium.
Ooh, that's not true.
Now, this does not mean salting your food.
Okay, I agree with that.
This means looking at all those processed foods. So a lot of processed foods have a lot of excess sodium.
80% of all your excess sodium comes from processed foods to have longer shelf lives, so you have shorter shelf life.
Yeah, so that's all just for preservatives.
Yes.
So also sugar. You can reduce your blood pressure by reducing your sugar.
Yes. And sugars make... Do you know what it is?
High glucose.
Oh, age is called age.
Oh, advanced glycation end product.
That's right. So that's what actually damages those end capillaries and nerve tissue that ends up causing the paresthesia and numbness and tingling and loss of limbs for diabetics.
Yeah. So we're damaging the tissues with excess sugar intake. Anything else for blood pressure?
Do you remember our show a couple of weeks ago? Do you remember how many oranges of sugar we need for a whole day, for the whole body?
3?
2.
2 oranges of that's all you need for sugar. 2 oranges.
So if you drink 1 glass of orange juice, you're causing advanced glycation end products.
1 glass of orange juice is like the equivalent of 100 oranges.
5 oranges. You're being a smart ass like me now. I am the designated smart ass of this joint venture here.
So blood pressure, other things you can do to reduce it. Yes. Stress relief.
That is a huge one. Huge.
Caffeine reduction.
Caffeine, that's huge, yeah. Except for like green tea, white tea, yellow tea, those amounts, like less than 25 milligrams of caffeine, those are actually going to increase brain function, memory, mood, everything. But above that, you get chocolate and soda, which is 35 milligrams, then black tea is 50. Then that starts causing the cardiovascular stuff.
Yeah. So let's look at another risk factor.
Another one?
Yeah. We've already started to talk about it a little bit. Excess glucose. Blood sugar. Anybody have trouble with blood sugar? Diabetic, pre-diabetic, insulin resistant.
That's every 1 out of 2 Americans in the United States.
Yeah.
Americans. 1 out of 2
What do we think about blood sugar?
Yeah.
So we've already talked a little bit about it.
Yeah, we talked a lot about that the other day.
I mean, we already talked about advanced glycation end products.
Yeah.
Awesome, Linda. She's trying out meditation and yoga for stress relief.
Nice. That's awesome.
Can't go wrong.
Yeah, and there's lots of meditation and yoga and mindfulness here in Wichita too, and surrounding areas, which is awesome.
Yeah. So we know glucose. We know blood sugar issues, sugar storage issues, contribute to heart disease. It is not what the typical instruction is that fat or cholesterol, dietary cholesterol, causes.
Fat does not make you have heart disease at all. Inflammatory fat does.
That's
anti-inflammatory. That fat prevents it.
Yeah.
Yeah.
So, okay, elevated cholesterol is a risk. Let's talk. Do we want to talk more about this? He says no. So let's talk about what kind of cholesterol, why people think cholesterol makes it a risk. How about that?
All right, I think that's good.
Okay, so do you want to start or do you want me to start?
Well, yeah, I want to hear what you say first, so then I can argue with it.
Okay.
All right.
So we already know we're creating damage to these tissues, right? Through inflammation, through excesses of the sugar and the salt. And we cause damage, we cause oxidation to all of these tissues, right?
That's right.
So it causes damage, and if we were to pretend, we have a blood vessel, maybe we pretend we have some damage on that blood vessel, and what happens is there's a certain type of LDL that attaches to those areas.
That's right.
In the blood vessel.
Yeah. LDL B pattern.
So it's a certain type of LDL that attaches there, almost like it's kind of patching it, right? And the more damage you create to the tissue, the more it will patch. And eventually you start filling up the vessels, they start hardening and narrowing, and then we run into those blockage issues that we don't want to have, correct?
Right.
Okay.
So then we blame the fixer, not the...
Yeah, so what is the real problem?
Yeah.
What is the real problem? Is it the cholesterol, or is it what happens before the cholesterol accumulation?
See? That's right. It's inflammation.
So.
It's like homocysteine and cardio-CRP, inflammatory markers, and nicotine and caffeine, and things that release endothelians. Yeah.
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 So it's not LDLs. There is no bad cholesterol. So LDLs, there's two main types. LDL-A, which are large, fluffy ones. Those protect the heart just like HDLs. They're very antioxidant. They protect the heart. So you can have high LDLs and have really great prevention for heart disease. But there's also the B pattern, which are the small, dense LDLs. And those are the ones that repair. And so again, they're not bad. God didn't make bad cholesterol just to kill Americans. That's crazy talk, right? So those repair just like they do in every other country. But we have a very inflammatory lifestyle, a very inflammatory diet, and then we don't eat anything that deplaques the arteries, which everybody else in the world does.
Yeah. So cholesterol's not necessarily the bad guy. He's just there trying to patch up all the damage.
Right. It's kind of like blaming the fire alarm for going off when the fire is downstairs burning up the house.
Yeah. So it is a symptom, and it's a risk factor in the sense that it's a symptom.
Yes. Well, but not total cholesterol, because the highest ones have lowest heart attacks, but the lowest ones have more heart attacks. But like low HDLs, so low protection, and high LDL-B pattern, which if you do a VAP cholesterol, like if your doctor really loves you and cares for you, they will do a VAP cholesterol, and then that will actually break down all the 3 HDLs, the 2 LDLs. They'll look at the pattern, they'll look at cardio-CRP, homocysteine, and then they really say what is really going on. But if it is going on, the treatment is still anti-inflammatory kind of therapy. So like when I look at my VAP treatment protocols, it's still just stop causing it and eat your way out of it.
Yeah.
So.
That's what we're getting to, Alfredo. He's dying for us to talk about plant-based.
Don't know.
Plant-based therapies.
He's a vegan.
So,
you gotta eat lots. The only way to cure Alfredo, the only way to cure heart disease is by eating lots and lots of copious amounts of meat.
So Newman says we look simply marvelous.
Well, Newman's marvelous.
Thank you, Newman.
And Newman works in his new building too.
Newman's so awesome. Newman works at Hunter Health, and Hunter Health loves patients.
Do they?
They do.
Oh.
Yeah. With that,
I feel like you're saying that like I don't. jeez. Bob's nice. Bob likes people.
If the shoe fits. Okay, so HDL. So we talked about LDL.
Yeah.
I want to talk really quickly about HDL because my belief is that if you work on getting your good cholesterol up, all the things you have to do to get that good cholesterol to increase it will take care of all the other things.
That's right.
So we want, if somebody says, oh, your good cholesterol is a little bit low, that should be a red flag there to say, I got to start getting that up.
Yeah.
Because that's cardioprotective. That's what will scour out the walls of your vessels. That HDL will help clear out and sand down those plaques.
Yeah.
And how do we do that, you may ask? How do we raise
there's
HDL?
No drug for it.
Does anybody know how
There's no medication for that. So what do we do?
how we raise HDL?
Yeah.
Listening.
Yeah. Mm-hmm.
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 Uh-huh. So, we're going to reduce excess sugar and processed carbohydrates intake.
Yeah.
That's one way.
Did somebody say that?
You know what happens when you do
that?
that? When you reduce that?
What?
That lowers your triglycerides. Your triglycerides actually lower the HDL. So, we don't want...
Right.
That's what I'm talking about.
And triglycerides are 5 times VLDLs.
So, that's one way. Healthy fats.
Healthy fats, yeah.
What are your healthy fats?
Mm-hmm.
Anybody know? What are your omega-3 fats? Jump on in there, people. I know some of you know this.
So Carolyn says taking niacin. Now niacin will, but you really should do niacin-rich foods. But if you take niacin, straight niacin, man, you will get a hot flash, usually like worse than you've ever had in your life. Like people go to the ER with that. But niacinamide is a way to take niacin that's non-flushing. Or non-flushing niacin is niacinamide. So, yeah, just be careful of niacin, but really you should do it through niacin-rich foods. But if you want to do something very quick, right? So sometimes people want to drop it for their insurance to get approved and then go back to normal. Then they use niacinamide for that.
So you guys are experts here. We've got eating avocados, we've got salmon, we've got nuts and seeds and coconut oil, we've got fish oil.
Yeah, yeah.
Those are your healthy fats. It might be chia seed, it might be flax seed. Those are your healthy fats. We increase those and decrease trans fats.
Yeah.
What are trans fats? What are the inflammatory fats? Do you know?
Trans fats were born one type of fat, but then they wanted to be another fat. Is that right?
I'm in support. I'm not implying that we're not in support of trans things.
So in chemistry, if the hydrogens on that fat is the same side at the double bond, it is called a cis formation, right? But if you cook that oil too hot, one hydrogen goes to the other side.
Whoa.
See that? And in chemistry call that a transformation, which is why we call it a trans fat.
Ooh. Is that hydrogenated or partially hydrogenated? Is that the same thing?
Well, yeah. So hydrogenated, you have your double bonds, right? And so there's a hydrogen that's missing from those double bonds. But if they hydrogenate it, they heat it up and break that double bond to where 2 hydrogens then could be there, but they start out like that.
Yeah.
So hydrogenated and partially hydrogenated is breaking the double bonds to make it solid at room temperature, but it makes it a trans fat from the beginning.
Yeah.
Yeah.
So Carolyn's saying, wouldn't sugar be your biggest inflammation causer? I'm going to say not necessarily. Trans fats are just as bad.
I don't feel like you really understood that and knew that. You're not acting like you're acting like you just knew that. Like
I just got to keep the show going. That's what I'm here for. And so
the day that I'm not impressing anyone ever with my knowledge, I'm gonna have to learn new stuff.
So trans fats, you could also call them Franken fats or manufactured fats or processed fats. These are fats that don't come necessarily in their original form.
Yeah.
And when you're cooking, you want to cook slow and low.
That's right.
Slow and low with the heat.
Very white cooking.
There are some avocado oil has a high smoke point, so that might be a good one to use.
550.
Yeah, he knows the smoke points. I don't know the smoke points. But,
Oh, well, do you? Olive oil is 350.
So processed foods,
Still don't care.
trans fats are in processed foods. So are you eating cakes, cookies, crackers, chips, fried foods?
She used to call me a cracker.
So you may think you're not eating trans fats, but a lot of us are still eating a lot of processed foods.
Yeah.
So
that's where if you get rid of like just eat fruit, vegetable, nut, seed, berry, legume, greens, things in the least processed form, you don't ever have to worry about that.
yeah.
And I like the cook low and slow. Food's important. Take your time. Take a few extra minutes to get things done, rather than just the get her done kind of mentality. You know?
Yeah. So reducing those will raise your HDL.
Yeah.
Exercise will raise your HDL.
That's right.
It's all cardioprotective.
And that's what HDLs, they're like a great metric to see how you're doing, because you can't fake HDLs. You can take meds that'll mess up the rest of them. They will mess you up in the process. But you can disrupt the formation of cholesterol, but you can't change HDLs with medications. You have to live that lifestyle.
Yes. And what's cool is you can make these changes within a matter of weeks.
Nice. That's
so
right. Oh, that's
within,
right.
I think Dr. Katz, I was watching a webinar with him. He's also functional
Nobody cares about
lifestyle
Dr.
medicine.
Katz.
It's always about him. He doesn't want to hear about
I like
any
Dr.
other doctors.
Dr. Dogs is way better than Dr. Katz.
Wow. Whatever. So, 12 weeks was what they found through studies, but I personally have seen my numbers change within less time than that. So if you get your blood work done, know that that is a snapshot in time, that you can make a difference in that just by changing some simple lifestyle practices. And you can change that very, very quickly.
I just changed mine during the talk.
Boom! He did some stress relief practices.
I doubled him. I already doubled him.
Alfredo says my brother is a trans fat.
Well, I support him.
Okay, so triglycerides also an issue.
Well, then, yeah, triglycerides a big one, but that's just sugar. So, like a really great diet, like Alfredo's diet as a vegan, is probably like 33, right? And then, like a really healthy diet might be like 80 something, like a good vegetarian with maybe a little bit of meat. And then a crappy diet is going to be like 150, 200, and then like really bad, you might be 300, 400, 500 on triglycerides. And triglycerides for long periods of time being elevated will mess up your pancreas, end up causing pancreatitis. And so we've had a few pancreatitis patients that, again, just changing diet, got all their numbers back to normal when nothing else would do that.
Does anybody know how you can immediately lower your blood sugar and or triglycerides?
Yeah.
Immediately without medication.
Stop eating sugar.
No, I mean like right now.
I know what you're going to say.
Right now.
You look at the why. This is propaganda. I know what you're going to say. Say it.
Does anybody have it? Anybody who's watched the show with me should know. What's the one thing you can do with right now without medication that will lower your blood sugar and your triglycerides?
And remember, she works at the YMCA. Am I on the right track?
Exercise, people, exercise.
Oh, it was exercise. I thought it was working at the Y. That was one. Oh, yeah. So Missy, I don't know. I feel
Thank you, Missy.
I feel like Missy said that right after we said it.
There might have been a delay there.
Missy be knowing.
She said exercise with a Z.
Nice.
Exercise.
Size. What?
So that's triglycerides. Smoking. Want to talk about smoking?
What about quadriglycerides?
What? I don't think he knows what he's talking about.
Did you say smoking?
Smoking. Talk about smoking.
Yeah, smoking is no bueno. Well,
2 times the risk.
Who needs this talk? Everybody knows it's bad. Everybody. Nobody smokes anymore.
That is not true.
Well, not just crystal meth.
I know
nobody smokes cigarettes anymore.
I know a lot of people who smoke.
Who smokes?
I'm not going to out them on our show.
We should.
On live
Next show,
Facebook.
if you don't quit smoking, we're going to out you.
a lot of people smoke. So think about why you smoke. 2 times the risk. I have a lot of great, awesome friends who do, and I love you.
Does
Regardless,
Blattrick do
there's
it?
no judgment.
Does Blattrick do it?
But
It's Todd. Is it Todd? Todd smokes, doesn't he?
I'm not talking to you about anything. I
I grew up
have
with
to.
all
I have
sisters.
to abide by HIPAA.
I have
So
all
I'm not sharing
sisters
anyone's personal health
and
information.
all daughters, so I need to gossip. Who is it?
Okay, so what do? We've got 15 minutes.
To solve all your problems.
Do we need to make this, do we need to extend this
Ooh.
show to next week?
Extends.
Oh, stop. You need to stop with
I have a
that.
ton of research to go over.
Linda says everyone vapes now. What, do you want to talk about vaping?
Yeah, so vaping's a horrible idea. It uses antifreeze. So,
I love
Now,
antifreeze. I mean, I know it's delicious, everybody, but I still love it.
I mean, sure, it tastes great. It's in your Frosties, you know, but no. So vaping, yeah, it's pretty toxic. But actually, I think you could vape because vaping is basically nebulizing, and so you could put good stuff in there and actually nebulize essential oils with some good stuff. But that's not
You're
what
not
they're
gonna.
doing.
There's still tobacco in the vape, isn't there?
If they add it, yeah. So you add like all your little chemicals, or you buy them pre-made, but the artificial colors and flavors are petroleum, and the polyethylene glycol is bad, or the propylene glycol that's in there is bad. So
Does that increase heart disease risk?
the nicotine does. Nicotinic acid like tears up the blood vessels, and then there's LDL B patterns go and repair it, and then there's oxidation because we don't eat enough antioxidants, and then it becomes plaquing. And then nobody wants to change their diet, and so we die. America!
Are you done?
Yes, alright.
Okay. Do you guys have any questions at this point? I haven't really checked in with you. We do have someone, Carolyn's asking about Plaquex. Have you heard of Plaquex?
Plaquex. Is that like the new
Treatment for
Plaquenil?
removing plaque from the arteries.
So Plaquenil, which this is probably just the newer version of this, but Plaquenil was actually discouraged from being used because it was no more effective than cheap-ass aspirin, but it had tremendously greater side effects.
You can actually find the words cheap-ass aspirin on the
Cheap-ass.
shelves nowadays.
Yeah. Well, it's
a brand name.
CAA.
Okay.
Cheap-ass aspirin.
Okay.
Comes with the malt liquor. Cheap-ass liquor, too.
What were you saying? I completely forgot.
I don't know. I feel like I start to say stuff that really is impactful, and then you make jokes. So,
So
Plaquenil is more dangerous than aspirin, but no more effective than aspirin. But think about this, okay? That's like, you know, Joe Bob's no more dangerous than Jerry, who's a serial killer, right? So, aspirin, studies show that it saves 10,000 lives a year by thinning the blood artificially, right? Causes this cascade dysfunction in the body. But it kills 14,000 people because of the side effects. So you're 50% more likely to die from the side effect than being saved from the blood thinning properties. But if you use something like nattokinase, there was a good article in the Journal of International Journal of Mystery. International Journal of Molecular Science in 2017, so that was last year. And it said that nattokinase, which is made from Bacillus subtilis, it's a great name. I think that'll be my stage name. But it has these fibrolytic units, or FUs.
He just likes to say FUs.
And 2,000 FUs is the same as 100 milligrams. But
We just lost 4 viewers.
well, fibrolytic unit. No. So you should go to the health food store and say, how many FUs do I need? And you gotta like
So
that.
we sort of kind of like nattokinase.
Right, but it said there was no side effects.
As
No
a-
adverse effects.
So if you had to choose to take a pill or a medication, nattokinase is not off the list of approved supplements by Dr. G.
You better walk that line, telling people. But yeah, so nattokinase is a wonderful thing. So like Dr. Sinatra, who's a cardiologist that does natural medicine, he's been a long proponent of that. And nattokinase, I mean, the research is super thick for that, especially within cardiovascular journals. But there's no side effects. It's like that BCP 157, like it does all this wonderful stuff, but has no side effects whatsoever. And you don't see that very often. Like even natural supplements, they'll usually cause some other issues, maybe, or at least potential. But no adverse side effects is amazing. And that's because when you look at clots are fibrinogen and fibrin and platelets all in a little ball, right? And then what nattokinase does is it makes an enzyme. Well, it is an enzyme because it's an ACE, but it breaks down fibrin. So it seeks out fibrin. So you can use this for like connective tissue disorders, for old scar tissue, Dupuytren's contractures, trigger fingers, that kind of stuff. But for the heart, nattokinase is the primary one to actually seek out blood clots and destroy them.
So if you have plaques and clots, that's going to be our next show, plaques and clots.
Well, that should be, because all my research, I did lots of research for you guys. Bam, look at that.
So plaques and clots.
I'm Texas educated. That much reading and writing, that's what I did in high school.
We like nattokinase. So, and just recapping, we don't want to have to take medication if we don't have to. We don't want to have surgery if we don't have to. If you are at the point where you've already got some advanced heart disease and or risk factors, nattokinase might be for you. Who would you recommend them partnering with to take their nattokinase?
So really, you should be doing that with like a natural medicine doctor or functional medicine doctor, clinical nutritionist, anybody that deals with that can kind of weigh the risks and benefits for what treatment that you're wanting to do. So that's what we do a lot in our clinic. And so people usually very easily get off their medication, don't need it anymore. And so it's not about stopping your medications, but really changing it to where you don't need that anymore. Yeah. And that's really the goal.
Yeah. So let's talk about some other things. We've talked about nattokinase as a supplement, but really most of our discussion is going to be about lifestyle.
Yeah.
And
so next week what we'll do, let's finish out this stuff here. Yeah. And then next week, I want to talk a lot about the research, and we'll kind of tell you about all the stuff that we found. But these are things that you can do, simple things the way that you eat, stuff from Harvard, stuff from Cornell, stuff from Zhejiang University, all these major entities and how they have figured out that the healthiest, happiest, longest living populations that have the least amount of heart disease, how is that possible? And damn it. I thought you were going to talk. And
I was.
And what is it?
So we're not going to get into a lot of the solutions today, not the full spectrum. We're going to get into that next week, like Dr. G said. But I would like to ask you, if you were going to pick, based on our talk today, if you're going to pick one thing that you might work on this week to help your cardiovascular health, what would that be? What will you choose? Please tell us what you're going to think about this week for preventing and or healing your heart disease.
Yeah, so one of the things that we already talked about was switching from the corn-fed to the grass-fed stuff, the free range, the wild caught, just that, because out of the 4 things that the prostaglandins create and cause from eating corn-fed stuff or corn-fed processed food is hypertension, pain and inflammation, arrhythmias, and clots for heart attack and stroke. And most Americans consume 40 times the inflammatory omega-6s as the anti-inflammatory omega-3s. So that might be one thing that we do over the next week is say, what the hell am I eating? Is it causing arrhythmias and heart attack and stroke, right? And what could I do to change that? So making those little changes Also exercise, eating more nuts and seeds.
So maybe this week you're looking at what your diet looks like.
Yeah.
You're tracking it. Maybe you take 1 or 2 days and you just track. It's really not that difficult. Keep a pad of paper at work and track what you're doing.
Yeah.
And then we can come back and discuss some of this. Beyond that, some very easy things. Exercise.
How much exercise? So when you say exercise, I always talk about purposeful movement, but some people want to undo. Some people have to kind of do extra to get back to the place where they can just do purposeful movement. So from your side, which you deal with this all the time, what are your thoughts on what the average person would call exercise for cardiovascular disease?
The American College of Sports Medicine, the ACSM, recommends 150 minutes per week at least. 150 minutes per week of exercise minimum for the week. And this can be moderate intensity. It doesn't have to be you're out there running at 1,000% on a treadmill, but moderate intensity, that's basically 30 minutes, 5 days a week.
Oh, 30 minutes.
So if you're looking for weight loss, if you're looking to do a little bit more, you can push that up to 200, 250 minutes per week, but minimum 150 minutes per week. Cardiovascular exercise, I would focus on that, but then it doesn't hurt to have your resistance training, to have your weight training 2 or 3 days a week, to have those mind-body practices or the stretching and balance practices, things like that.
And I want to read real quick. I included this picture for you guys. That's in my feed. But it talks about the actual causes of heart disease. And I want to run through these just briefly, and we'll talk about more of this next week. But this is the real cause of heart disease, right? We said 1% of heart disease is genetic. The rest of it is what am I doing to cause this problem? And your cheapest solution is always a plane ticket and get the hell out of America, because if you eat in Europe and you drink and stress like they do, 70% less heart attacks but higher cholesterol, because it's the whole lifestyle of what they do. So the real causes are things like low omega-3s, so that we just talked about that. We eat high inflammatory, low anti-inflammatory. So that's that wild-caught, free-range, grass-fed, grass-finished, nuts and seeds, fruits and vegetables.
Healthy fats, yeah.
Healthy fats. High insulin, which is too much sugar. High glucose, which is too much sugar. Low vitamin D, because we think the sun causes cancer. Because, again, God made the sun to kill Americans because he hates our freedom.
So we need the sun, we need vitamin D.
You don't like my freedom thing? It's all played out.
I've just heard it.
It's all played out.
I've heard it 400 times.
I know. Increased high homocysteine, which is a lack of B12 and B6, which is fruits and vegetables. Oh wait, no, it's beans, greens, and fermented foods and probiotics. Low potassium, which is low vitamin K, and that's because of greens. We don't eat greens. Low testosterone, because we exhaust our hormones or we take medications like statins that prevent it from being made. High estrogen, because of dairy and plastics and hormone replacement and birth control. Low nitrous oxide, because we don't go out in the sun. Low HDLs, because we don't eat healthy fats and exercise. Oxidative LDLs, because we don't eat antioxidants. The average American eats 1 fruit or vegetable a day, mostly brown and white stuff, like chips and French fries. So we don't eat antioxidants. High triglycerides, which is sugar. High fibrinogen, because of all this, inflammatory diet. And then high blood pressure because of stress and diet.
Yeah.
So that's the real actual causes or risk factors of true heart disease, and it's all lifestyle. It's all things we have control over. And one of the things to consider is if you're at a risk. My dad died probably, I think in his early 50s. He had a stroke after amputating his foot and then his leg and then above the knee. And they died from complications of diabetes, type 2, right? So my goal then says, hey, I am likely to have the same outcome if I do what my dad does, right? Or did. So I don't want to live his legacy. I don't want that to be my children's legacy. So I made deliberate changes to my lifestyle and to ensure that my children don't suffer the fate of their grandfather, that don't suffer the fate of what I would do. So I made purposeful, meaningful changes in my life so that way I wouldn't suffer the same fate as him, because it's not genetic.
Yeah.
But we tend to do what our family does, which gives us the same results. So you are very empowered that you can fix these things.
Yeah.
And you... All right, go ahead.
I was just going to say that when you think that you don't have any control, that really makes you a passive participant in your own life. And what we're saying is that don't be a passive participant. It'll be better if you're an active participant in creating these new lifestyle changes. I do have one very serious question from one of our viewers.
Yes,
James says, where does where does Taco Shop fit in with a heart-healthy diet?
So, like Taco Bell only makes 50% of their meat is meat.
But we're talking about Taco Shop.
Is Taco Shop real stuff? I'm pretty sure it's not.
I have no idea.
So it's corn-fed inflammatory meat that in corn-fed oil, I'm sure, which then dramatically increases your risk of heart attack, stroke, and arrhythmia. The corn tortillas are inflammatory corn, which then increases your omega-6s, which puts you at a higher risk of heart attack, stroke.
I'm really sorry, Taco Shop lovers.
But the tomatoes and the lettuce, that's awesome. The salsa has benzene in there, which is the flammable part of gasoline.
How do we know their salsa has benzene?
Well, maybe it doesn't. Taco Bell does. And then we'll have to figure this out. And then the cheese is just astronomically high estrogen. Like you make this much, a cow breast milk is that much. So cheese is an astronomical amount of high estrogen, which one of our risk factors on the chart is high estradiol. So tacos should be cardiovascular disease causing, but they don't have to be. If you got organic corn tortillas from like natural grocers, and then you got beans, like if you got pinto beans or healthy beans, put a little cumin, chili, onion, garlic in there. Mix that bad boy up, mush it up.
Make your own tacos, people.
And then lettuce and tomato and avocado and some real salsa. And that thing is anti-inflammatory, disease reversing, and you can still have your tacos.
All right. It doesn't have to be things you hate.
That's right.
Deb says she wants an enchilada so bad. I feel you. I never get tired of enchiladas.
And an enchilada can be healthy
ever.
Too.
All right.
Get your wild-caught buffalo. I usually hide in the trees and I'll jump out and break their neck real fast so it's pain-free.
Yeah, don't forget when you slaughter it to blah, 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 blah.
So you can buy it at the store, I guess, too, right? So you can either do a vegan or you can do a regular one like meat. But you can make your own. All the Mexican food should be super healthy if you make it with super healthy ingredients.
Yeah.
Yeah.
So... Okay, well, we are out of time for tonight. We're going to continue this talk next week. Is there anything in specific you want us to speak to next week? That way we can bring it back to you.
Yes.
And maybe we can tie in things like food addiction or some other thing that is a contributor to... A lot of the comments we've had tonight has been about food and not being able to eat the things that we like and love, and why is that? Why do we like and love them so much? Maybe that's something we can talk about as well.
And often it's not really the food, it's what we do to this food. That's the biggest difference that we have. And we don't have the balance. So you can eat some bad if you eat a lot of good, but we just eat almost all bad.
Right.
Yeah.
Right. Okay. Well, Deb, we can talk about cheese alternatives as well.
Avocado.
Okay.
Yeah.
It's a healthy fat.
Yeah. All right, you guys.
I think we're done. Take care of yourselves. Pick something to do this week to focus on. Come back and tell us what it is.
Yeah.
And we will talk to you next week.
Bye, you guys.
Bye, thank you.
Don't touch that button.